Prescription drug coverage could cost much more next year for millions.
Every year gets higher, higher, higher.
Millions of Americans who do rely on this particular Medicare subsidy will be paying more.
The biggest risk with Medicare Part D changes coming in 2027 may not be higher premiums. It may be making the wrong decision because you're worried about higher premiums. You've probably seen some of the headlines. A government program that has helped stabilize Medicare Part D premiums is ending. And yes, that could mean higher premiums for some retirees next year, but that is only part of the story. At the same time, some prescription drug prices are coming down. There are fewer standalone Part D choices than there were just a few years ago. Insurance companies can change which drugs they cover and which pharmacies you can use. And as I'm recording this, we don't have the final 2027 premiums for individual plans yet. So I don't think the question that you should be asking is simply, is my Part D premium going up? The better question is, what is my total cost going to be? And am I still in the right plan? Because those are two very different questions. So let me show you what is exactly changing and what isn't changing, and most importantly, what I think you should do about it. Hello, and welcome to the Financial Fast Lane. My name is Lane Martinson. First, let's clear up the biggest misconception. Medicare Part D is not going away. Your prescription drug coverage isn't disappearing. What's ending is a temporary government program called the Part D Premium Stabilization Demonstration. Now, don't worry about remembering that name. Here's all that you really need to know. Medicare Part D went through some major changes beginning in 2025. One of those changes put a limit on how much someone could be required to pay out of pocket for covered Part D prescription drugs. But those changes also shifted more of the financial responsibility onto the private insurance companies offering Part D plans. There was concern that this could lead to significant premium increases, and so the government created a temporary program to help stabilize premiums while the insurance companies adjusted to the new system. Think of this as a transition period, that temporary program that ends after 2026. That is what's changing. Could some standalone Part D premiums go up because of it? Absolutely. But here's what's important. We don't yet know what your individual plan is going to charge in 2027. Those final plan details won't be available until later. So anybody telling you exactly what your Part D plan is going to cost you next year is getting ahead of the facts. We do have some official 2027 numbers from Medicare, and I think that's useful because it puts some perspective around what's happening. So you can see here the base beneficiary premium, 2026 was $38.99, going to $41.33, and then the out-of-pocket maximum going from $2,100 to $2,400, and then a standard deductible up to $615, going up to $700. Now, what I want to be very clear about is that first number. The $41.33 is not necessarily what your Part D plan is going to cost. That's a national base beneficiary premium used in calculating plan premiums. Your actual premium could be higher, could be lower, depending on your plan. And that's really the point. These national numbers only tell us something about the direction of Medicare Part D. They don't tell us what you are going to be paying. There's another part of this story that I think deserves more attention. The standalone Part D marketplace has been getting smaller. There are fewer standalone Part D choices available than there were just a few years ago. So why does that matter? Because when insurance companies face higher costs, raising premiums isn't their only option. They can change deductibles. They can change copay or co-insurance, which is simply the list of prescription drugs that they cover. They can change which pharmacies are preferred, or they can stop offering a particular plan. And any one of those changes could potentially cost you more than a small increase in your monthly premium. Which brings me to one of the biggest mistakes I see people make when evaluating Medicare drug coverage. You don't want to confuse premium with cost. Let's say you have two Part D plans. Okay, Plan A costs $20 a month, Plan B costs you $50 a month. Which one is cheaper? On the surface, it seems obvious, but we don't have enough information to know which plan will actually cost the least. For example, what if one of your prescriptions isn't covered by Plan A, or it's on a more expensive tier, or the pharmacy that you've always used is no longer preferred? Maybe Plan B costs you another $30 a month in premiums, but saves you $1,000 over the course of the year on prescriptions that you actually take. So which plan is cheaper now? Obviously Plan B. And that's why I don't want you to confuse premium with cost. They're not the same thing. You don't want to compare just premiums. Also compare deductibles, your prescriptions, drug tiers, co-pays, co-insurance, pharmacy network, and total expected annual cost, which is the number that really matters. Now here's where the story gets more interesting. Because while a temporary program designed to stabilize premiums is ending, something else is happening at almost exactly the same time. Prices negotiated by Medicare for another 15 high-cost Part D drugs takes effect January 1 of 2027. These include some very well-known and widely used medications. So think about what's happening. On one side, some Part D plans could potentially become more expensive, but on the other side, Medicare has negotiated lower prices for certain high-cost prescription drugs. This is another reason why I don't think you can look at a headline that's saying Medicare subsidy is ending and conclude that my Medicare costs are going up. Maybe they will, maybe they won't. It depends on your situation. There's another piece of good news that's kind of getting lost in some of these headlines. The annual out-of-pocket limit for covered Part D prescription drugs remains. It's currently $2,100 in 2026, and in 2027 it increases to $2,400. But before this protection was added, someone taking very expensive medications could potentially face much higher out-of-pocket costs. So let's put this into perspective. Yes, a temporary premium stabilization program is ending, but Part D isn't ending. Your prescription drug coverage isn't disappearing. The out-of-pocket protection still remains. And negotiated prices for another group of high-cost drugs takes effect in 2027. This isn't quite the simple story that some of the headlines make it sound like. So will you pay more in 2027? I wish I could give you a better answer. But right now, the honest answer is we don't know. Some people probably will. Some premiums may go up. Some deductibles could change. Some formularies could change. Some pharmacy networks could change. And some people may benefit from lower negotiated drug prices. Your outcome could be completely different from your neighbor's, which is why I wouldn't make any decisions today based on speculation about what your plan might cost next year. You want to wait until we have actual information and then make an informed decision. There's one decision in particular that I want you to be very careful about. If you currently have original Medicare, a Medicare supplement, and a standalone Part D plan, don't make a major change in your overall Medicare coverage simply because someone shows you a lower drug premium somewhere else. For example, you may see a Medicare Advantage plan with a very low or even $0 drug premium. That doesn't automatically make it better. And I want to be clear, I'm not saying Medicare Advantage is bad, and I'm not saying Medicare supplements are always better. They're different. Either one can be appropriate depending on your circumstances. But your overall Medicare coverage involves much more than premiums and your prescriptions. It includes which doctors you can see, which hospitals you can use, and coverage if you travel, for example. And also, if you leave a Medicare supplement and later decide that you want one again, you may not necessarily have the same ability to purchase a Medigap coverage later. There are guaranteed issue protections in certain situations, and some states provide additional protections. But the rules vary, so just don't make a major change in your overall Medicare coverage because someone showed you one attractive number. That's a principle that applies to a lot more than just Medicare. Don't make a big financial decision based on one number. You want to look at the whole picture. So what should you actually do right now? Probably nothing. Now, there's nothing wrong with paying attention, but don't make a change based on incomplete information. And then in September, watch for something very important from your current plan. It's called the annual notice of change. And please don't throw it away. Your annual notice of change tells you what's changing in your coverage for the next year. Look at your premium, look at the deductible, look at your prescriptions, and make sure they're still covered. See whether the tiers have changed. Check your pharmacy. And then compare your existing plan with the other Part D options available where you live. Medicare open enrollment runs from October 15th through December 7th. Your current plan may still be your best option. If it is, keep it. But don't keep it simply because it's the plan you had last year. And don't change it simply because another plan has a lower premium. You want to compare the total expected costs. And this is where I think this Medicare story becomes a retirement planning story. One of the biggest mistakes we can make in retirement is looking at financial decisions in isolation. Healthcare affects your spending. Your spending affects how much income you need. How much income you need affects how much you may need to withdraw from retirement accounts. Those withdrawals can impact your taxes, and your income can even affect what you pay for Medicare premiums. These things are all connected, and that's why I've always believed the good retirement planning has to look at the whole picture. And it has to be flexible, because things change. Medicare changes, tax laws change, Social Security changes, markets change, your health changes, and your own priorities change. If you're retired for 20 or 30 years, I can almost guarantee you something isn't going to be exactly according to your plan that you made at age 65. And the goal isn't to predict every change. The goal is to be prepared to make a good decision when change happens. Of course, the headlines will keep coming. Your retirement decisions should be based on the facts, not on headlines. I hope you found this helpful, and I look forward to seeing you in the next episode of the Financial Fast Lane.